So there's another breast implant on the market, and I want to tell you all about it, but I want to go quickly through the history of breast implants. You know, breast implants basically started as liquid silicone. It was even injected into the body. That caused lots of problems. That liquid flowing silicone was very, very inflammatory, caused a lot of scar tissue, a lot of problems. And so over time, we learned we need to put that silicone in a shell of some sort, contain it within a shell. And so that's what we did. And we had these smooth shells, and we had liquidy, syrupy silicone on the inside. And those implants, those older implants, 30, 40 years ago, they were porous on the surface. The shell was not completely intact. It was porous on the surface. So what happened? The liquid silicone on the inside beaded to the outside of the implant. That caused an intense inflammatory reaction. We used to say that women had hard implants. Well, actually their implant wasn't hard, but the body made a hard scar shell around the implant and turned a beautiful teardrop shaped implant into a round, hard coconut, basically. And the surgeon had to peel away that outer coconut hard shell, take out all that liquid silicone, and then hopefully replace it with a newer breast implant. But so what's happened over time? Two big things. The outer shell has become more intact, where nothing can leak out of it and nothing can go into it. Also, the inner silicone is no longer liquidy syrup. It is now cohesive. And we are on the newest generation of cohesivity with regard to silicone, making it safer and safer and more user-friendly, less likely to cause irritation to the body if there is a rip or a tear in the implant. You know, we know silicone itself is inert. It's not dangerous for you, but it can be irritating. And so that's why we really want to contain the silicone in an implant. So these, implants are smooth, they're round, they take on a nice, beautiful teardrop shape. And this technology has evolved into an implant that's now gone, but it was a very rough textured implant made by Allergan. It was kind of referred to as the gummy bear. That's sort of a misnomer because all silicone implants today are kind of referred to as a gummy bear, but that implant had a shape. It had this permanent teardrop wedge shape to it. And the reason why it was so heavily textured on the outside was to prevent movement, because heaven forbid your implant goes upside down, then you have an upside down breast. Not good. So that texturing, that sandpapery feel was meant to lock that implant in place so that it could not move. Well, what happened was, and I've seen it 100 times, so has every other plastic surgeon, not always does that implant stick and integrate. Sometimes, even though it's textured, it developed a second capsule around it and it still moved around, and that scratchiness caused an inflammatory reaction, something that today might be referred to as BIALCL, that's breast implant associated anaplastic large cell lymphoma. Not good. It's treatable if it's recognized early. So that particular implant was taken off the market, and surgeons and patients freaked out over any kind of texturing whatsoever, even, micro textured implants and things like that. So, and then everybody went back to the smooth implant. I've always used a smooth implant through all these years. It started with saline and now silicone. I've always loved the smooth implant, and I'll tell you why. No matter how it's situated in the body, it always has a beautiful teardrop shape. It's allowed to move, and it causes no problem. It always looks beautiful. It's a little harder for the surgeon and for the patient to keep it in place, but over the years, we've developed great ways of doing that, and that is absolutely not a problem any longer. It does have these knuckles, and with the newest implant that has come out that I'm about to show you, you will see that those knuckles are pretty much gone. The texture is not shiny, stark like this, nor is it a sandpapery feel. So in other words, it's not smooth and it's not textured. It's something else that I'm going to show you and tell you about. But what I really wanted you to know is that the more dangerous implant, the very rough textured implant, has been taken off the market. You don't have to worry about that anymore. Pretty much this has been the standard of care, smooth, round implant. It's very unlikely going to cause any problems at all. We tend to put it behind the muscle just because it does minimize the rate of capsular contracture. Now that even this implant is so much better, I do see the pendulum starting to swing where it is safer to go above the muscle in terms of preventing capsular contracture. The problem is these knuckles. So in thin women, you can't do it. In women who have very little natural tissue, you can't do it. So we have another alternative to the smooth, round, sort of standard of care implant I'm about to show you. And by the way, this smooth round implant is made by Sientra, Allergan, Mentor. Very, very similar in the technology and as far as the cohesive silicone gel on the inside and then the shell on the outside. Very nice integrity. Nothing is wrong with this implant. But there is a new implant on the block. This implant's been around for about 15 years. It's been really popularized and used in this country for about 10 years. And it is neither smooth nor textured. Look at it. It has sort of a bluish hue to it. This is the most natural, healthiest implant for women today. Why? Well, we call this surface, this beautiful, bluish, kind of a cloudy surface. We refer to this as the 4 micron silk smooth surface. So it's a silk smooth surface. It behaves like a smooth implant. Doesn't have the dangers of the heavily textured implant. It has a beautiful shape, beautiful teardrop shape, just like the round smooth implant has. But when you're laying down, it's not rigid and firm like that hard gummy bear implant that was taken off the market. You can still refer this to like a gummy implant. It is cohesive silicone gel on the inside and the 4 micron silk smooth technology on the surface. And so this implant, because there's not many knuckles, look how beautiful it is. You can put this implant in front of the muscle. That will avoid animation defects when you're squeezing your pec muscle, pulling up, doing bench press. In those situations, women's implants that are behind the muscle will distort and they will move. That's not dangerous, and it goes right back to where it should be when you stop that movement. But with this implant, you don't get that. The recovery is a little easier. You can imagine from lifting up the muscle, putting an implant under it, to just going on top of the muscle. We call it subglandular or subfascial. Both are options. Now that this implant is so user-friendly, it can be used in thin women, women with little natural breast tissue. This is definitely a great choice. And I just want to kind of tell you about it from sort of some more specifics. Surgeons can use smaller incisions. That's also very appealing to women. So that, together with the fact that there's been not one reported case of BIA-ALCL, that's the lymphoma. There's been no reported cases of BIA squamous cell carcinoma, none of those. Very low capsular contracture rate. So what is capsular contracture? Capsular contracture is when the body forms excessive scar tissue around an implant. It can actually distort the implant and turn it into a ball rather than that beautiful teardrop shape. So we don't want capsular contractures. This has a very, very low rate of capsular contracture. Very, very important. This implant is also so much more able to help correct a tubular breast deformity. I think it works great with breast augmentation and a lift, mainly because you don't have that muscle getting in the way. This is right where the natural breast tissue is, you know, if you go above the muscle. So that's a great option for women. But we call this the most biocompatible, patient-friendly, healthiest breast implant for women today. And then the other thing I was saying, that it is 100% filled. You don't have to overstuff a woman's breast with an implant just to get the look. You can get it with this implant much, much easier. Those are basically the main points I wanted to say about this newest implant on the market. If you have a smooth round silicone implant in your body, not to worry, it's still a great implant. These implants, again, they can go behind the muscle, in front of the muscle. This is a great decision that you can make with your board certified plastic surgeon. This company, Motiva, only sells their breast implants to board certified plastic surgeons. That to me says a lot.